The amount of pain that someone is going to experience after surgery differs greatly from individual to individual. There are multiple factors that influence the level of pain someone will experience after surgery. Those factors include the amount of pain someone was in before surgery, also the type of surgery, also were there any unexpected complications after surgery. Another large factor is if the person was taking pain medication prior to surgery, because in those patients, the way that their body interprets and processes pain is different from patients who have not been taking long-term pain medication. So when people ask, how much pain can I expect to be in? Unfortunately, we can't give you a really good answer, and it simply depends on the individual and varies greatly. So when you're in the hospital after your surgery, there will be orders written for you to have access to pain medication. There are multiple pain medications used in the hospital setting. They typically include oxycodone, hydrocodone, and Percocet, as well as Dilaudid. These orders will typically be written as an as-needed basis. So your nurses won't be giving you the medication unless you ask for it. So make sure to have a very open dialogue with your nurse and be very honest with them about your level of pain and the need for pain medication. They will ask you to rate your pain from 0 to 10 on the pain scale prior to administering you medications. So it's a really good idea to be a great advocate for yourself and ask for these medications before your pain gets out of control. If you find that your current pain medication regimen in the hospital is simply not meeting your needs, you can ask to speak to the neurosurgery physician's assistant, who can make changes in your pain medication regimen at any time. That might include increasing the dose of your current pain medication or potentially changing the medication altogether. Now, some people are discharged the day of their surgery, while others are in the hospital for several days. Regardless, at the time of your discharge, the physician's assistant from our inpatient neurosurgery service will prescribe you with pain medication at the time of discharge. Typically, this is a small prescription limited to approximately 20 to 30 pain pills. Often this prescription can be filled at Maine Medical Center at the time of discharge, or it can be picked up at any pharmacy of your choice. We certainly recommend picking up the medication on the way home from the hospital if you're able to, so that you can take your pain meds and have them accessible to you as soon as they are needed.